This is Ethan with Staying Healthy Kimberley on Warringah Radio 693 AM. Today we have Jo from Boab Health Services. Hello, Jo.
Hi, Ethan. Thanks so much for having me on the show today.
Yeah. And what's new at Boab Health recently?
Well, with the increase in COVID-19 cases in WA over the last month and the likelihood that these cases will continue to increase with the likelihood of the WA border opening up to interstate people, the WA Chief Health Officer has advised all non-hospital health services to move to Telehealth services.
Yeah. And does this all mean that all your services will be over the phone or live, live cam?
Yeah, exactly. We most of our appointments with our mental health team, our ITC team, which is Sam and Aileen, which many of your listeners will know, and our allied health team, which is our dietitian, diabetes educator, podiatrists, are all moving now to appointments over the phone or a video call. So that's either through a laptop or a smartphone.
Yeah. And what are the reasons for these changes?
The reasons for the changes are to help keep our clients and our staff safe. So with our appointments now being over the phone or a video call, there is a much less chance of COVID-19 being spread during our services. We know telephone and video appointments are not ideal for many of our clients, but our number one priority is to keep our clients safe and to reduce the risk and the likelihood of COVID-19 spreading if and when it does arrive in the Kimberley.
Yeah. And what about the health promotion and also the group programs?
Yeah, so unfortunately it means our health promotion, our group programs are temporarily on hold. Again, we know this is not an ideal situation, but we must do all we can to reduce the chance of COVID-19 spreading. One exception to our telehealth services is our clients with foot ulcers. So our podiatrists will continue to see clients with foot ulcers face-to-face and in clinics wherever possible, and this is because we want to reduce the chance of someone losing a foot via a foot amputation.
Yeah. And what about the services for people who don't have access to telehealth services?
Yeah, that's another really important question, Ethan. Our staff will contact local health services to discuss how we can best support clients and all members of our community, including those without telephones or laptops, tablets or internet access.
Yeah. And when will you be back in developing outreach and face-to-face services?
Yeah, we need to follow the rules set out by the WA Chief Health Officer, and we'll review the changes to our telehealth services every few weeks or so. We want to get back to delivering services face-to-face and outreaching back to communities down to Balgo and up to Clumbaroo and most places in between as soon as we can.
Yeah. And how can people contact Boab Health for more information about it?
Yeah, so people can jump on our website at any time. That's www.boabhealth.com.au. Head to our latest news and then our COVID updates page. They can also call us on 9166 8100 or send us a message via Facebook.
Yep. Thanks, Jo, for coming on the show today.
Thanks so much for having me on Staying Healthy in the Kimberley, Ethan, and it's really great to see all your staff wearing masks in the office.
Okay. Thank you, Jo, for coming on the show.
Thanks, Ethan.
That was Jo Sadler from Boab Health Service on Staying Healthy Kimberley on Warringah Radio 693 AM.